The process always will involve a full consultation and x-rays, not necessarily at the consultation, but we do like to have a good picture of things before we commit to making those longer appointments. So that will be an x-ray, perhaps a scan as well. And once we've got all of the information, we'll have impressions of your teeth so that we can look at the ridge of gum ready to hopefully accept an implant. Then the appointment itself for the implant would usually come about 6 or 8 weeks, if possible, after the tooth comes out, so that any infection settled, the area's healed well, and hopefully we're ready to go and place the implants. The treatment time will very often be as long as 4, 5, maybe even 6 months. Sometimes we can turn things around inside 3 months, but the gums have to heal after implants are placed, and they have to be in their final resting place before you would consider taking an impression to put the crown or bridge work on. So it doesn't happen quickly, but you wouldn't want to go to a practice, spend a lot of money, and for it to be done overnight. You would much rather that the dentist was taking time and care over your treatment. The final appointments are for the fitting of the restoration, whether it's a crown or a bridge on implants. Sometimes it might actually be dentures that are fixed onto implants with other components, what we call precision attachments. And these can come in the form of little clips or what we call riders that lock onto a titanium bar. There can be female components within a denture which will lock onto gold locators. And they're useful techniques for patients that are maybe not ready or able to have full crown and bridge work, because when we're replacing teeth, we're also thinking about replacing the gum and the bone as well, because you get quite a lot of shrinkage or contraction of the tissues when the teeth are lost, particularly if there's been trauma or infection. The fitting of your restoration, that appointment is obviously one of the most important, and you'll be given a mirror hopefully to accept that this is a very nice result that we've achieved for you, and you'll be happy with it before we actually go ahead. And you can give us a thumbs up and we'll get this crown or the bridge cemented. After you've had an implant, you can more or less carry on as if the implant were one of your own teeth, because there's nothing really that you can't bite into that we wouldn't advise you to in regards to your own teeth. We always tell patients that they need to be very careful. Try not to use your teeth for things that they shouldn't be used for. For example, biting into an apple is absolutely fine. Biting into crusty bread is fine. But try and avoid using your teeth as a tool to open packets, or even maybe bite your nails, or getting the sachets open with the tomato sauce and things like that. Or sweetie wrappers. Porcelain can fracture if it's put under heavy biting forces and pulled in a different direction. But we would tell you that if it was your own natural teeth anyway. Well, it's always one of the questions that you're faced with. The likelihood of post-operative swelling or pain is quite low nowadays with implants. They're placed with a lot of irrigation using saline, which helps to keep them nice and cool, and therefore you're also 100% numb when we're placing the implants. It's done in a very controlled environment, so there may be some swelling, some bruising and some discomfort for 2 or 3 days, and that would usually settle. We'll be supplying you with some anti-inflammatories and perhaps some antibiotics as well to reduce any post-operative infection or swelling or pain. It's now almost 12 years since I embarked on the year course. In fact, yeah, almost 12 years since I embarked on the year course through in Edinburgh to study dental implants, and in the intervening years we are often on seminars or conferences, sometimes within the UK, sometimes outside of the UK, but trying to update our knowledge. Systems change, but now I think the changes are very subtle. Like for example, the texture that coats the implants is the topography, as we call it, is now studied much more under the microscope compared to the early implants. It was really just the threads and the shape of the implants that were being focused on at that time, but now it's actually the chemical constituents of the topography that we like to look at those and make sure that the integration with the bone is almost immediate. We obviously still like to delay the placement of restorations on implants. We try to make sure that they're fully integrated before we actually let you go away and use them to chew your food.
This is gold.
Occasionally you'll see patients that come in from other countries, and I suppose like the UK there'll be good and bad practices everywhere, but sometimes you see things that are very interesting and very different in other countries, and unfortunately I think dental tourism has become probably a little bit too popular in recent years. I think it's very important that patients will find a treatment provider that's, if not local, certainly accessible for them within a couple of hours, so that if there is a problem, usually we'll make sure that we see patients within 24 hours. If you've got an infection, you don't want to be phoning your dentist in Poland or Hungary, and unfortunately people can find themselves in that situation. It's really upsetting for them, because although they may feel that they've started out that journey to save some money, they might not in the long term save anything at all, and unfortunately if the problem isn't attended to quickly, then it can manifest itself as a failure, and that's a big stress. We were very fortunate that last year we had absolutely no failed implants. We didn't remove one single fixture as a result of infection or pain or any issues at all, and we've had probably about 3 years that have been like that in the last 6, which I think is quite good. And occasionally things do fail, and it's at that stage it becomes more important in terms of how you deal with the failure. And our assurance initially is always to make sure that we would replace an implant free of charge within the first year. And if it integrates well, beyond that first year, there tend not to be problems or issues or infections.